Hi, Wendy and Dr. June. Tell me a little bit more about yourself and your work.
Yeah. Shall I start?
Yes, please.
Sure. So my name is Dr. June Chin, and my story is I was actually a patient, a cannabis patient, before I even became a physician. When I was a teenager, I was diagnosed with a crippling arthritic disease of the spine called ankylosing spondylitis, or AS for short. And what ends up happening is your spine literally fuses together. It's almost like crazy glue. You lose the ability to flex, to extend, to rotate, to turn your head. And I went through conventional treatment, of course, as a teenager. I did NSAIDs, non-steroidal anti-inflammatory medications. I did muscle relaxants. I did over-the-counter acupuncture. I even did epidurals. And I'd wear this back brace all the time to give myself stability. And by the time I got to medical school, I was having such a hard time standing. And I was so disheartened because I was surrounded by wonderful physicians, great medical minds, but no one could really help me. And one of my attendings, one of my mentors, Dr. Levine, pulled me aside one day. And he was a specialist in HIV and AIDS. And he said, "What's going on? You're always wearing this back brace. You're having a hard time standing in the OR or helping deliver babies. You're not going to make it. You're not going to make it through med school like this." I explained that I had AS. I explained that I was in excruciating pain all the time, but I really couldn't take any medication, especially while working in the hospital or while studying. It was so sedating, and it got in the way of my academics. So he handed me this tincture bottle. It was marijuana. And I remember he had said, "Don't freak out. I'm going to give you something that's out of the box." And he handed me this tincture, and he said, "My HIV and AIDS patients use it, and it really, really helps them with the pain and discomfort." And I knew I had reached this fork in the road, and I knew if I didn't try something, that I was going to have to drop out of medical school. And to my surprise, when I took it, it worked. I took it over a weekend when I wasn't working, and by Monday morning, I knew it was working. So from then on, I decided to dedicate my career in learning about this plant medicine. And here I am decades later. I integrate medical cannabis in my patient care. I help patients work with other physicians, work with their specialists, and integrate cannabis safely.